Hello guys, Dr. Qureshi here, and today's video is going to be focused on eye makeup because I get these patients. As a matter of fact, I had one patient today who came in because she had severe reaction to some kind of glue that she had used in her false eyelashes. And I keep seeing these cases like all the time where these patients are coming in with some kind of issue with their mascara. Reused mascara is a big no, remember that, or using makeup which is not recommended by ophthalmology. It's just like a constant struggle trying to educate the patients about what brands are good and what are not good. So patients are kind of not aware of these things. So I decided to make a video specifically about what kind of makeup is good for the eyes and what is not. Okay, so you have to be very careful. So some of the products that I do recommend are going to be Physicians Formula is a good brand, and then I also recommend Neutrogena, which is also a good brand. I also think I had read somewhere Physicians Formula, Neutrogena, Clinique are good brands. And if you're looking for something for mascara, I would recommend L'Oreal, which is a good brand also. Again, do not use someone else's mascara wand for your eyelashes, because that's like I said, it's a big no. As far as patients coming in trying to wear makeup and I'm treating them for infections of their eyes, or even treating them for blepharitis or crusting of their eyelashes, I do not recommend using eye makeup until the eyes are totally healed. So if I'm giving them antibiotics or let's say steroids for about 2 weeks or even 1 week, I do not recommend using anything in that area. The most that you can do is just wear like a moisturizer on the face, but nothing around the eyes until the eyes are totally healed. Same thing happens when they have a corneal abrasion or corneal ulcer. Absolutely, I do not recommend doing any kind of eye makeup in that time period. And some of the other things to remember is the eyeliner. Okay, so I know a lot of us wear eyeliners. I do that myself, but tight lining. So women would understand that more than men. And men do not have to worry about that because it's like a woman thing. So tight lining is when you try to wear the eyeliner under the lid area. So I do not know how to demonstrate it for you, but if you look at my face right here, so it's going to be under. So you know there's a with a liner or pencil liner or a wand, you can do the tight lining. That's not recommended by eye doctors and eye specialists because I attended a seminar few years ago where this doctor gave a very good lecture about how the tight lining can potentially affect your meibomian gland function. So remember, meibomian glands are made under the lids, and if you're tight lining that area with an eyeliner, it's definitely going to clog that area even more. So don't do tight lining. If you want to do an eyeliner for parties or occasions or special events, then you can do the eyeliner like normally people do, like on this area on top of the lid, instead of going under the lid and making that line under the lid. So that's like not recommended, tight lining. As far as makeup is concerned, remember everything has a shelf life. There is an expiration date for everything. So if your mascara is really old, look at the expiration date. Do not use it. Discard it. Get something, replace it, get something new. And same thing goes for lipsticks and other makeup products, but I'm trying to focus on the eyes. And since I'm talking about the eyes, we're not going to ignore the eyebrows. If you're doing the eyebrow, gel brow or liquid, I think it's not liquid, it's gel brows that people do, or the one with the brush versus the one with the pencil, like the pencil brow. Again, keep it clean. Keep all your brushes really, really clean. Hygiene is really important for the eyes, because if you are not using clean utensils, you can get infections and you can get inflammation. You can also end up having crusting, which is known as blepharitis. And I'm thinking about making a video specifically on blepharitis because I've been getting a lot of these cases in the clinics lately. And that's not only with the females. I have seen a lot of guys with blepharitis also. So that would be something that I will talk in the future. But again, just to recap everything about the makeup, remember the makeup products that I'm recommending: Neutrogena, Clinique, Physicians Formula, and some products with L'Oreal also. And throw away the products that are getting expired. Do not use anyone else's makeup. Keep all your makeup sponges, brushes, all of these things very, very clean. Wash them, clean them, and then discard them, and then replace them with something new. So that's about eyes and makeup. And if you have any questions, feel free to ask me. Remember, less makeup is better in my opinion. Less is more, because we're all beautiful. Women are born beautiful. We are gorgeous. We do not need to do too much to our facial features. And also, one more thing I just remembered is I have had quite a few cases of false eyelashes where either the glue burned the cornea or caused a big abrasion, or it caused a chemical reaction. Sometimes the glue can get stuck in the eyes, and I remember there was a case where I had to scrape it off of her cornea, and that can leave a scar also, and that can affect your vision. Another thing I just thought about is nails. You have to have shorter nails when you're doing contact lenses or doing eye makeup, because it's very, very common to get your cornea scratched when you're doing your eye makeup with with long nails. Because with long nails, I mean, pretty much we are doing a lot of the blending and stuff like that in our eyes, and especially for contact lens wearers, we are using our fingers, and if you have long nails, it can scratch the cornea. It's a big possibility. And how do I know? Because I have treated enough cases for that as well. So those are some of the things to remember. So instead of false eyelashes, just do the regular mascara. I mean, it's fine to do a regular mascara. Like I said, we are born beautiful. We do not need a lot of makeup. Keep it simple. Keep your skin tone beautiful. Keep your inner beauty alive, and we're going to look beautiful. We will be glowing. So the inner glow is also very important. Okay, guys? And then I will make that video about blepharitis very soon. You take care. Enjoy your holidays also. Bye.